Abscessimab is an antiplatelet drug, an anti-cancer drug, anti-rheumatoid arthritis drug, anti-tuberculosis drug. So, one small hint I'll give you, whenever this Zumab MAB comes, it is definitely monoclonal antibody. To specifically for this question, if you have XI in your drug, then it is antiplatelet drug. So what is this Abscessimab? This Abscessimab is a chimeric monoclonal antibody. It's a chimeric monoclonal antibody which acts against your glycoprotein GP, that is glycoprotein 2B3A receptor. Okay, which acts mainly against your glycoprotein 2B3A receptor. Okay, so what is this 2B3A glycoprotein receptor? Okay, all its family, such as Abscessimab, Tyrofibin, Fibin, and eptifibatide. You have one more drug called eptifibatide. All these three, they act against, the mechanism of action is glycoprotein 2B3A receptor, that is they are glycoprotein 2B3A antagonist. So what is this glycoprotein 2B3A? This glycoprotein 2B3A is a glycoprotein which is found on the surface of platelets, and among all the receptors, this is the most abundant receptor found among the platelets. Okay. So this activated glycoprotein 2B3A binds your adhesive molecules such as your fibrinogen, von Willebrand factor they promote clotting. Okay. So basically they promote clotting. The main purpose of your glycoprotein, it promotes clotting. This Abscessimab, eptifibatide, and tyrofibin, they bind to this GP2B3A receptor and they stop the clot process. Okay, so this tyrofibin and eptifibatide inhibits the platelets binding to your fibrinogen. I have told you 3 drugs, right? This Abscessimab will bind to this glycoprotein 2B3A and they will stop the clot formation. This too will inhibits the platelets binding to your fibrinogen. Very simple. I have told you the mechanism of action. Okay. What about your other points? Like what are the other things that you have to know about this drug? This is a very non-specific drug. Okay. This is very non-specific, so that it will not only bind to GP2B3A, it will bind to other proteins also. Okay, so they are available only in IV form. Okay, mainly they are available in IV form, intravenous bolus followed by continuous IV. They are combined with aspirin. Okay, they are combined with aspirin and heparin. Okay, so after a bolus, suppose say if you give a bolus of intravenous bolus, your action remains for around 12 to 24 hours, that is for 1 day. Okay, your T half is going to be 10 to 30 minutes. Okay, 10 to 30 minutes. Then after continuous infusion, it stops rapidly around 6 hours. Okay, and then remains in blood for 15 days. So I'm going to tell the pharmacokinetics. I'm going to just revise. It is available in IV form. Aspirin, you're combining it with aspirin and heparin. Then it remains for around 1 day. T half is going to be 10 to 30 minutes. After continuous infusion, it clears rapidly in 6 hours and it will remain in the blood for around 15 days. Okay. Other things that you have to know about this is, what are the adverse effects associated with this drug? So what are the adverse effects? You will have hemorrhage. Then you have thrombocytopenia. So it should not be repeated after second time. Okay, you have to give it a time. Then it causes paralytic ileus, then constipation, erythema. These are some adverse effects. Your drawback is going to be it is a very expensive drug because it's a monoclonal antibody. What are the uses? Now coming to the uses. Mainly your uses are going to be unstable angina because you have to stop the clot. That is, you have to block the clot process, and they are given as an adjuvant to coronary thrombolysis. Coronary thrombolysis. And during a stent application, they are given. So the main adverse effect is going to be during angina, that is unstable angina. Okay, so what are the things that we have learned? We have learned few things, and what are the other things that you have to know? Abscessimab is the FAB antibody fragment of your chimeric monoclonal antibody 7E3. Okay, 7E3. This medication will inhibit your platelet aggregation by reversibly binding to your glycoprotein, which results in your hindrance of your clot formation. Simple. I have told you the mechanism. Then what else that you have to know about this Abscessimab is other antiplatelet drugs. Say I am just giving you a rough image. You just have to understand this. Say if this is your platelet, your surface of platelet, you have two receptors. Okay, you have two receptors. Let the receptors be little bigger. Okay, these are your glycoprotein GP receptors, GP 2A 3B receptor. 3B receptor. So this Abscessimab, it just acts like this. It just acts like just binds to this GP, okay, GP receptor, and will break the clot. What are the drugs breaking it? One is Abscessimab, eptifibatide, tyrofibin. Okay, these three that you have to remember. What about the sticlopidin, clopidogrel, prasugrel? They inhibit your ADP mediated platelet aggregation. Aspirin will irreversibly inhibit your cyclooxygenase. So these are the other drugs, like other options that you have to know considering your exam. So basically you have to know Abscessimab. It's a chimeric monoclonal antibody. Okay, it's a chimeric monoclonal antibody acting against glycoprotein 2B3A receptor, which is the most abundant receptor present on the surface of the platelet. This will bind to the fibrinogen, promotes clotting. It stops clotting. Okay, I am telling about the role of glycoprotein. It will promote clotting. So this, if Abscessimab inhibits your glycoprotein, it will stop your promotion of your clotting factors. So this is non-specific, which means it binds to various other receptors. Okay, so it is available only in IV form. It is combined with aspirin and heparin. I have told you about the half-life and other minute details. These are your adverse effects. Okay, these are your adverse effects that you have to know. And uses mainly in your unstable angina, they give you this Abscessimab. Okay.